That to me, like I said before, there's dentists that are made dentists and that are dentists that are born dentists. To me, we have a lot of dentists that are born dentists, and you are one of them.
This is a training very important to me and also for the office because it's from the ITI, the International Team of Implantology.
We are the only dental clinic in Mexico to have 8 international accreditations. That speaks a lot for the people that are dentists that represent us, and that speaks a lot for the company itself. Hello, welcome back to Supremedental Podcast Studio. You could be anywhere else in the world right now, but you're here with us, and we appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to like and subscribe. Remember, this podcast was meant for you, the patients. So we have a phone number and an email address you guys can call, leave voicemails, leave emails. Any subject you guys want us to touch on, we got you guys covered. Now, today we have someone who has not yet been in the podcast, a very special someone, Dr. Ivan. How you doing?
Hi, how's everything going?
Everything's going great. Now, Dr. Ivan, you are an implant specialist.
Yeah.
And we get a lot of different questions that we have from our patients and different agencies that we work with. But one of them that we get all the time is patients thinking that by going to a clinic in Mexico and paying less, they're actually receiving less quality. What does that mean to you? What does that entail? What do you want to tell the patients out there?
That's a very good question, Frank. About that, we hear that a lot. Usually the patient think they're looking for something cheap, but when they come here, they're just getting something sometimes even better. They can say, I hear some patients saying, I got this dental treatment in the United States, and you're top of the line, even better. I hear that before very often.
Yeah, actually, one of the things that I also hear very often is when patients come in and they say, wow, you guys have digital x-rays. You guys have a wonderful facility. You guys scan everything. That's not how it is in my clinic back home, and we have patients from Florida, from New York, from Seattle, from Texas, you name it, we've got them. And patients feel sometimes that before they come down, some patients feel that, well, you know what, I'm going to go to Mexico, I'm going to pay less, I'm going to receive less quality. But that's not the case at all. Like Dr. Ivan said, we don't try to be as good as clinics in the United States. We try to be better. We try to be the best possible for our patients. So, for example, Dr. Ivan, you actually go through different training. You became a dentist, and then how long have you been going to school to become an implantologist?
There's 2 years. There's 5 years of dental school, just to be a general dentist. After that, you go through 1 year of social service, who means you're working in a government facility. And after that, you to become an implant specialist. I got a 2-year training in the specialty of becoming an implant specialist. After that, there's a lot of extra training, like the sinus lift surgery. You have to go through another training. You have to go to another training just to be the all-on-4 specialist. All techniques get shaped with the new training.
And that's something very particular that we have here is we have a lot of dentists, for example, in the U.S. that you go in and there's a dentist, general dentist, you need to go to an implantologist. So they send you somewhere else for the implantologist. And now something's wrong with your sinuses, and they send you somewhere else for the sinuses. I feel that doctors sometimes in different parts of the world, they go to a different level and then they stop doing what they're doing. Like the implantologist won't do any crowns or won't do, a deep cleaning. And the guy who does the sinus lifts a lot of times won't do the implants. They just do sinus lifts. So, and here, dentists, and I'm going to say probably in different parts of the world, not just Mexico, maybe in Brazil and Colombia and Venezuela and different places, they strive to do as much as possible in the clinic itself. So, for example, you went to school 5 years to become a general dentist, and then you went to school. Then you did 1 year for the government, correct? Like
Yes.
a social service.
Social service.
And then after that, you went 2 more years to a specialty to become a specialist. And if you want to do a sinus, you need to go to a different training in different place, different time. If you want to do different things, you got to keep on becoming better to have more weapons, more arsenal when it comes to our patients and they come down. You actually are able to help them out at the max capacity that you can. Now, has it happened before to you that you get a patient and is above what you know? What do you do when a patient comes to you and needs something that you can't do? What are you being an implantologist already? What do you normally do?
Usually, the first checkup, it's very important. We check X-rays. We take X-rays of everything. We get CT scans. The medical record. We have to know about your general health. And something very important, it's we have all the specialists in the same clinic. That means if there's something I don't do, like root canals, we call to a root canal specialist. And it's not in another office like in another clinics. Here in the same clinic, we have all the specialists. They come here, they see the patient, they see the X-rays, and they give you the opinion.
So it's an in-house. Everything's in-house. Nobody has to go somewhere else.
Yes, in the same clinic.
But for example, let me ask you the question. So let's say that I go to you and you see something in my mouth that you cannot do. What do you do? What do you tell me?
As a patient?
As a patient, yes.
As a patient, we explain what's going on in your mouth with the X-rays and everything, and the specialist is gonna the other specialist who is doing the other treatment I not do, he's gonna perform it.
So then, when you being an implant specialist, there's things that you can't do.
There's things. Yes. There's things. There's special conditions that make you stop about the treatment, like some kind of medications, or like if the patient smoke a lot, because smoking is very bad for the implants also.
Yeah, that's actually one of the main things that makes them fail. No, so for example, but you just say that I went to you and you told me, hey Frank, you know what, you need a bone regeneration.
Mm-hmm.
Do you just tell me, hey, you know what, I can't help you, or do you bring someone else to help me out?
No, of course I bring someone else. If there's something I know, I have the experience, and I do this before, very successful so many times, I'm gonna do it. But if there's something that it's out of my level, even in the same specialist, there's specialists with more experience. In case there's something I cannot do, we call to another specialist to have a second opinion.
And that, to me, like I've said before, there's dentists that are made dentists and that are dentists that are born dentists. To me, we have a lot of dentists that are born dentists, and you are one of them. You really love what you do, and obviously we do this as a business. Obviously, he makes money, he has a family, but he knows when to say, you know what, I can't do this, but I have someone who can do this. And then you let the other doctor know, and you gave the best possible solution for the patient. That is incredible. That to me is knowing what you can do, and it just makes you grow even more.
Welcome to Children's Dental Facts. Did you know that the tooth enamel is the strongest thing in your body? You heard it first at Supremedental Podcast. If you didn't know, well, now you know.
Now, being a dentist in Mexico, what challenges have you faced with our patients when they come in? I know you've been a dentist for quite some time. You worked here at Supreme. You worked at other places before. What are some of the challenges, perhaps, when a patient comes to you and you are from Mexico? What are some of the challenges that you face when they tell you, oh, no, well, my doctor in the United States told me something different? What are one of the challenges that you face?
The first thing might be how scared is the patient, because sometimes even not just because they're in another country, just going to the dentist could be scared.
Yeah.
For some people could be a little spooky.
A lot of them are kind of traumatized from when they were kids too.
Yes, that happens. They told you since they get in the chair, they say something like, "First of all, I hate dentists." That's
I've heard that many times before.
A little rough.
But what have you, besides that, what are some of the things that you've encountered that a patient says, that makes, because there's a lot of patients that feel that perhaps you're not up to the standards as their doctor back home.
Okay. The first thing is let know the patient he have to do research before they go to any dental office, not just in Mexico. If you go to a dentist in the United States, it's very good if you do some research about the accreditations of the clinic. If the doctor, it's a doctor.
Yeah, very important.
That's very important. And also maybe look at some pictures of their work. We have a lot of
some before and after.
Some before and after, yes.
So you know what, you pretty much said what I would have said. Accreditations means accolades that your clinic or where you're at have obtained over the years, and Supreme Dental Clinic has 8 international accreditations. We're very proud of that. We are the only dental clinic in Mexico to have 8 international accreditations. That speaks a lot for the people that are dentists that represent us, and that speaks a lot for the company itself. So when you guys do your research, make sure that where you decide to go, let's say you decide to go to Supreme, or you decide to go somewhere in Cancun or Cabos, or wherever you guys decide to go, Brazil, Argentina, make sure you guys do your research on the dentist you guys are going to, because you're putting your trust on that person. And it's not like, well, I wish I could go here, but now I can only afford to go here. Those doctors a lot of times are better trained than your doctors that you were seeing back at home, because they would send you to different places for different things. And here, the doctor that you're going to see, if you do the right research, they're going to be a doctor that's able to take care of 80 to 90% of what you're going in for. And if they cannot do it, they'll bring somebody in-house to be able to help you out. That is extremely, extremely important. Actually, you just came back from a training in Argentina, if I'm not mistaken. Or where did you go? Oh, Brazil. No, you're about to go to a training in Brazil. I'm sorry. Yes. You're about to go to training in Curitiba, Brazil. Mm-hmm. Are you excited about that?
Yes, I'm very excited, Frank. This is a training very important to me and also for the office, because it's from the ITI, the International Team of Implantology. Also, the brand of the implant, Straumann, is not like a commercial or anything, but
we should be getting paid for that. But
yes, it's a brand who collect all dentists from the whole world, and we got a lot of new techniques.
You were chosen to go to represent us in Brazil, and I know that I said Argentina because we've had 2 doctors that went to Argentina. We've had a doctor that went to Spain. We had a doctor that went to Harvard. We had a doctor that went to Switzerland, and now you're going to represent us in Brazil. How does that make you feel? That you're a dentist from Mexico. You are part of the American, the ADA, the American Dental Association. You're an international member, and you're also part of our clinic, which we have 8 accreditations, international accreditations. But how does that make you feel that you're from Mexico, but you're going to go expand your knowledge in Brazil?
It's very important to me. Also, I have a lot of research also about the doctors in Brazil. Doctors in Brazil are very good.
Phenomenal doctors.
Very, very good doctors. Also, they're famous.
They're famous. There's some famous dentists out there.
Yes.
Wow, that's awesome. And what do you feel that you're gonna obtain in this? What do you want to bring back to the team, to yourself?
The better thing about this training is that it's a hands-on training. That means you're doing some skills in real patients. Sometimes when you go to training in the United States, you have to be an American doctor to perform a treatment in an American patient. But when you're going to, as a dentist, if you're getting a training in Latin America, they let you do things on patients, and that's skills you can get with practice. That's the very best part.
But and what do you think about the trainings that you can do? What's the difference about the training that you can do online or the trainings that you can do hands-on? You think there's a big benefit that differ between them?
Yes, Frank. Both getting a training online is also good, but hands-on it's a big difference because experience makes everything makes a big difference. Also, I took some online training, but like a hands-on training, it's top of the line.
There's nothing like a hands-on training.
That's better.
You get to ask your questions. You actually get the skill, not just mentally, but also physically. You're there and you're seeing how everything works. And that's one of the things that we see a lot with different dental clinics is that they have trainings online, and there's nothing wrong with trainings online, but there's nothing like doing hands-on. And a lot of other clinics, a lot of people have asked me before, why do you send dentists, or why are they going to different parts of the world? They could just do it on the computer. But it's because you guys come back with so much knowledge and so much different techniques. Then you teach the team and the rest of the dentists that have gone to other places, and now everybody becomes so much stronger. And that's one of the main reasons. Oh, well, congratulations on you're about to go there. What, in one or 2 weeks?
Next week.
Next week?
Next Saturday, yes.
How long is the flight to Brazil, if you don't mind me asking?
It's like 13 hours. It's very far away from here.
13 hours.
And also, it's a big country.
It's a huge country.
Yes, it's a very big country.
Now, let me ask you, Dr. Ivan, and I've asked this to everybody, every dentist that we've had that been here. You've helped many patients. You've helped patients to do all-on-4, because you do all-on-4. You've had patients that came with no teeth, and you gave them immediate loads, and they're able to walk out with something automatically in their mouth. You also had patients that you reconstructed their whole mouth and gave them brand new crowns, gave them a new smile, gave them a new confidence in themselves. What has been one patient in particular in your mind, without saying any names, that you have said here at Supreme, like, wow, like that you remember that it's been something that really meant something to you?
Usually it's easier to remember the picky ones, and there's nothing wrong about being picky. It's fine. I know you're getting a lot of work, and you was expecting something very big, and that's what we give it to you. But usually those are what you remember most, the more picky ones.
The picky ones?
Yes. At the beginning, you might be a little. It's a lot of work, but once you see the before and after, you get very happy with the results.
Is there one in particular that you, because you live like an hour away from here, right?
Mm-hmm.
That you've been driving back home and you're just like, hey man, you know what? I really made a difference on this patient.
Mm-hmm.
Has this been that particular patient, or you just have so many of them?
I got a lot of them. Here we do this daily. Full mouth reconstructions.
We do this lately. No, you know what? And there's nothing wrong with that. I mean, we do have patients that are just like, I love my smile, and there's patients that are very picky, but that's okay because it's their mouth.
Mm-hmm.
So you know what? Thank you so much for that. We know you're a father. You have two
boys.
Two boys. You're also married. You're also about an hour away from here. You want to say hi to your wife?
Hi.
and I want to say hi to my wife also. And you know, very, very important that you're also. We're very proud to have you here. And we know you work long hours for our patients, and we don't leave until our patients are extremely happy with their work. And we want to say, you know, thank you for that. And definitely congratulations on your way to Brazil. I've seen your skill. I've seen the difference that, sometimes when dentists are added to Supreme Dental, we go through a lot of dentist applications, a lot of interviews to be able to get somebody in the team, and they have to have not just the quality on paper, but also the human side, also the attitude. And I feel that you have a great attitude. When I interviewed you, you're very positive, and I actually have never seen you mad, which kind of scares me. But I think you're a great asset to the team, and so do our patients. We've had a lot of patients that have written amazing reviews on Dr. Ivan. You have numerous pictures of patients with you, and we want to congratulate you for that.
Thank you very much, Frank.
So with that, thank you so much for joining us here today, and we wish you the best in Brazil. And thank you so much for everybody who's watching. Don't forget to like and subscribe. Don't forget to send us those messages either by voicemail or by email. We will be answering everything as we go. Thank you so much. It's been a pleasure.